Hospitals in Gaza have begun to collapse as they run out of fuel and supplies. Throughout this war, we've been in touch with Ghassan Abu Sitta, a Palestinian British doctor at Al-Shifa Hospital in Gaza. He recently started using vinegar to treat the wounds of his patients against infection. These are some of the voice notes he sent us today.
So today there was no electricity at Shifa Hospital between 9 in the morning and 1 in the afternoon. Now they're running a smaller generator just for the operating rooms and the intensive care units. The smaller generator will just run these ventilators and incubators in the operating room, but we will be limited to what we can take to the operating room, so only life or limb saving. The vinegar is because we've run out of things to treat the infections, and the wound infections have gotten worse because you can't take the patients to surgery as often as you need to, and because the hospital is so overcrowded. Vinegar is for a bacteria called Pseudomonas. Every few days I go across the street to a corner shop and buy 3 or 4 bottles of vinegar.
The United Nations Relief and Works Agency, or UNRWA, has lost dozens of people from their staff since October 7th. UNRWA is the UN agency for Palestinian refugees. They're now calling the situation in Gaza desperate. We've reached UNRWA's Director of External Relations and Communications, spokesperson Tamara Alrifai. She joins us now from Amman. Tamara, it's nice to meet you. Thanks for joining us today.
Hi.
This conflict in Gaza has taken an enormous toll on your organization. The last report I've seen is that 70 of your staff have been killed. What can you tell us about what's happened?
I can tell you that the figure today is 72. Every day we hear news about colleagues killed during the fighting. These are engineers, doctors, social workers, teachers, neighbors, mothers, fathers, people like me, like you. They look like me, they look like you. So we're extremely sad. These 72 people are part of a huge UNRWA staff corps. UNRWA, the UN Agency for Palestine Refugee, the biggest UN agency in Gaza. 13,000 staff, most of them displaced, like civilians in Gaza, many of them living in shelters that belong to the same agency, UNRWA, they work for. In that status of being displaced in shelters, many of them still wake up every morning, go around the shelter, make sure that people are okay, receive the wheat, flour, and bread that other colleagues bring into the shelters, distributed. The doctors continue to give consultations to displaced people around them. These are really heroes. My colleagues are heroes.
So the work persists in spite of everything, but there have been warnings from your organization that you might have to shut down your operations because of the overall safety environment and also an inability to get the fuel that you need. Where do things stand now, Tamara? How close are you to potentially shutting down the work that you do inside Gaza?
We're very close if we do not receive fuel. However, my colleagues, the ones I just described, they just continue doing what they need to do inside the shelter. But as an agency, as a huge international organization that belongs to the United Nations, it is just incredible that we do not have the food, the fuel, the clean water, the medicines that we need to be able to do our work. A few days ago, indeed, we warned that without fuel, we will not be able to move our trucks around. We will not be able to distribute food. We will not be able to give fuel to bakeries and to hospitals for life-saving and life support machines, including incubators. We will not be able to use fuel because we don't have it for water, for water and sanitation, and for water plants. Gaza, already before this conflict, was a place where clean drinking water was very scarce. 90% of Gaza's water was deemed unfit for human consumption before this conflict. And Gazans relied heavily on water pumping and water desalination.
Right.
right now with no fuel, this can stop any moment.
You talked about your people who are still doing work, even though many of them have been displaced and they're in shelters. These numbers change all the time, but the last I've seen is there are about 690,000 people currently taking shelter at your various facilities. I mean, how are they functioning? How much are they meant to hold?
Let's put it that way. Before this conflict, UNRWA had prepared itself to receive about 250,000 people in our shelters. When I say shelters, these are schools, so they're meant to receive children. But because sadly, Gaza continuously survives conflicts or goes through conflicts, we can reorganize some of these schools into shelters.
Right.
So we had prepared ourselves to receive 250,000 people. Now we're getting close to 700,000, and we were not ready for that. No one was ready for that level of forced displacement. 1 million people had to move from the north of the Gaza Strip because they received evacuation notices from the Israeli authorities, had to move from the north to the south of the Strip. The Strip, for context, is 364 square kilometers for 2.2 million people. That is extremely, extremely dense on any normal day. Not that Gaza has any normal days anyway. But today, with that conflict, with the constant strikes, the air bombing, and nearly 2 million people crammed in half the Gaza Strip, our shelters can never function properly. And because we don't really have electricity or clean drinking water or not even enough food, people inside these shelters are stressed, distressed, traumatized, hungry, and many mothers just want to bathe their kids, and that has become a luxury.
Yeah, the sanitation challenges and the basic health needs under those circumstances are severe, as is the situation in the hospitals. We just played a voice note we got from Dr. Ghassan Abu Sitta, who's working in Al Shifa Hospital. He talks about the power being out for 4 hours today. He talks about how they've had to resort to use vinegar to clean wounds to deal with bacterial infections. What does that tell us about the supply situation in core facilities inside Gaza today?
It tells us that the health system in Gaza is about to collapse. And that is something that my colleagues who work in the health sector have already reported to us. The fact that war surgeons, veteran war surgeons like Dr. Ghassan, have to resort to vinegar because for the last 10 days, he has been asking for sanitizer and hygiene supplies is very, very tragic. The fact that my colleagues report that in Al Shifa Hospital, that same hospital Dr. Ghassan is in, people are sleeping in the corridors and on the floor. My colleague Tom in Gaza visited the hospital and said he had to walk in between and over dead bodies in the corridors. We heard that there are no body bags available anymore in hospitals and in Al Shifa. For context, Al Shifa is probably the oldest hospital in Gaza, the longest functioning one, the one that is the standard referral hospital for all Gazans, and that is the one that is most active during conflicts. Dr. Ghassan goes into Gaza every time there's a conflict and donates his time, his energy to the war wounded and to war surgeries.
He clearly isn't getting what he needs, despite we have seen that some aid is getting into Gaza in recent days. I know you've described this as a trickle, and I know it's a fraction of what goes in to Gaza during peace times. Is it making any difference what is going in? I mean, do people notice the relief when these trucks come in and distribute what they have?
In the big picture, no. It's not making a difference. And if you could go around asking people in Gaza whether they're getting access to food or to medicine, they will predominantly say no. But we are also in a situation where every individual life, if we can make a difference, then that's almost a miracle. So if you ask those who receive bread on the day, they would say, yes, I got bread, and that is thanks to these supplies going in. But 20 trucks a day is really very, very little in the face of what Gaza is today. 20 trucks a day isn't something we should be rejoicing about, and is a very disappointing outcome of very intense political diplomatic negotiations and huge logistical organizing. So what is most needed now is to make sure that the flow of aid into Gaza is significant enough in the face of the needs, but also safe and unimpeded. We've asked for a humanitarian ceasefire. We want to be able to circulate across the strip, not just to the southern part where most people were displaced. We want to be able to reach people where they are. And we know that many people are still in the north for various reasons: pregnant women, disabled children, old people who cannot move. There are many, many civilians still in the north, and we need to be able to get to them.